Have you tried everything, and I mean everything, to fall asleep? Supplements, sleeping pills, sauna, yoga, breathing, meditation. There may be something more to your insomnia. Hi, I'm Dr. Val, integrative sleep medicine physician and women's sleep expert, here today to discuss two things that may be disrupting your ability to fall asleep and get the rest you need. First, I want to talk about delayed sleep phase syndrome, also known as being a night owl. So this is a circadian rhythm concern where your sleep onset or your sleep time is actually delayed by a few hours. It's a very common reason why people come to me in my clinic for help with insomnia. People with delayed sleep phase syndrome have a hard time falling asleep when most people, and I say most people, do feel sleepy somewhere between 9 to 10 or even 11. And typically once they do fall asleep on the weekends, where their bedtime can be a little bit later because during the week they have to get up early for work, the bedtime may truly be somewhere between 1 a.m. or even 4 a.m. I've seen as late as 5 or 6 a.m. How common is it? Well, up to 16% of young adults have this, and some research does suggest it's more common in women of middle age. Because of this, they often feel like someone's a night owl, and the world isn't really created for that. So, well, what do you do if you think you may have delayed sleep phase syndrome? A really effective approach is to phase advance your sleep. What do I mean by that? Turn your clock back by about 15 minutes every couple of days. Another thing that's super helpful that's supported by science is actually getting bright light in the morning, at least 10,000 lux for 30 minutes, even up to several hours. You can do this by going outside if you live in a very sunny area, or you can actually get a light box to put on your desk to shine that light in your face. Consistency is key and being really good about your habits at night. But this is something that can really help, and I've seen it time and time again for people that I work with who have delayed sleep phase syndrome in my practice. Another thing that you may consider is if you don't have delayed sleep phase syndrome, or maybe you do, and on top of that, you have a hard time falling asleep because your mind is just super active, or maybe you've lost hope in your ability to fall asleep, something called cognitive restructuring. It stems from cognitive behavioral therapy for insomnia, where we have a lot of sleep anxiety at night because maybe we've gone weeks, months, even years without sleep, and it just feels so dreadful. So one thing you can do is actually take a look at your thoughts. So write your thoughts down, whether they're positive, negative, or neutral, and maybe ask yourself, is this thought really true? What evidence do I have to support that? And maybe you can get to the point where you can shift your thoughts. Well, maybe I can't fall asleep within an hour, but I know that I can actually relax. And there are things that I can do to help slow down my brainwaves. Maybe like think about a really relaxing vacation. By really acknowledging the thoughts you have in and around your sleep, you can find yourself falling asleep faster. And really what it does, it's removing the pressure you put on yourself to fall asleep. Maybe sounding very simple, but guess what? It really does work. If you struggle with sleep and want someone to help you along your way, there are trained psychologists, even some physicians undergo this training as well. It's the Society for Behavioral Sleep Medicine. We'll put the link in the notes below. The Society for Behavioral Sleep Medicine, and you can find a practitioner in your area. There are also really good books. A great book that I like to recommend my patients is called Say Goodnight to Insomnia, that people found really helpful, and also a great app called CBTI Coach. That's a free app by the VA. So if you have a hard time falling asleep and you've tried a bunch of gadgets and pills and apps and still struggle, you may just have a delayed clock where your clock is shifted, sort of like jet lag, and you can use light therapy to shift it back. And another thing is examine the thoughts you have in and around sleep, because the thoughts you may be having could be self-sabotaging your sleep, and learning how to reframe and restructure those thoughts can really result in a peaceful night. I hope you found this video helpful. I'm Dr. Val, an integrative sleep medicine physician and founder of Sleephoria. To learn more about women's sleep health and full living, please subscribe to our newsletter. The link is below. Until next time, ladies, sleep well.